Next presenter will be Dr. Purban Ganguly, expert oculoplastic surgeon from RIO. He will be presenting his talk on the battle of integrity, facing the physical, mental, and social media harassments.
Thank you, Dr. Kuila and other faculties for giving me this opportunity. Now, how to handle the harassment. I will begin with this thing that all statements that are given against us is not destructive criticism or harassment. We have to differentiate between a constructive criticism and destructive criticism. Constructive criticism will be specific. A person will say that this thing needs to be done, or this is where I have found that it is not up to the mark. It will have a balance. The statement will contain something positive about you or your institution and something negative about it also. It will be suggestive. There will be suggestions for betterment. I think that this should be done for a better patient care. It will be time bound, not that something happened 2 years or 5 years before patient is coming and putting it on social media that this doctor has dealt with me. That is a destructive criticism. It will be immediate. And there will be no individual focus that this staff has done this thing to me. It will be a kind of a generalized thing. And it will be goal directed. The person wants you to improve. So first thing that we have to decide on that if someone is not with us, is not necessarily against us. And if we find a criticism, all criticisms are not harassment. And if we find that a criticism is not making me happy, then we should not have a knee-jerk reaction always. There are different types of harassment. We will focus on civil and criminal and cyber harassments only. Now, what is a civil harassment? Someone is stalking you. He's following you everywhere, wherever you are going, or standing in front of your hospital with no purpose at all. Sublime threats. Okay, Doctor Saab, thoda kam kar dijiye. I stay near your place. I can help you. If you are not doing that, then there might be situations. Nagging. There was a patient who was a beggar. I was supposed to perform a DCT for that patient. The patient was convinced that he will get it done in the private hospital and for a very nominal fees. The patient came at the time of 6 a.m. and sat in front of the hospital and ultimately got the DCT done. The violation of modesty, this is mostly for women, and undue attention. For all the civil harassment cases, if you feel, you can have a restraining order from the court. Criminal harassment may be mental, may be physical, and may be cyber or social media. Mental harassment, you can get a threat call, you can get a message, it may be a political pressure, it may be a hierarchical pressure, especially in government jobs, it can be a face-to-face threat. Now, if it is a mental harassment, all calls, we get calls from every patient every time. We are very irritated about the calls, but we have to remember that all calls are not harassment. What will tantamount to harassment? If somebody is annoying or threatening you, if somebody is making a statement or comment that is offensive, if somebody is not revealing his identity and continuously asking you for this kind of medical help or that kind of financial help, or someone is abusive. So if we are getting a call or a mental harassment case, what should we do? First thing, let the patient go out of your room or ask the patient that I will call you back after 5 minutes. Then start a documentation, digital preservation of the call, or make it under video recording. Do not use counter threats or do not use abusive language against the patient. If you are using abusive language also, then you are also at a fault, at the same fault as the patient is doing. He can also say that you are mentally harassing him. Politely drive the conversation. Make the patient say the threat again and again. What will you do if I don't do this? What will you do? Make the patient say it, make the person say it again and again. And make the person reveal his identity. That I am this, who are you? Tell me your name. Or which patient you are relating to, which patient you are talking to me. So these are some things which need to be done. There are, you can lodge an FIR for mental harassment. There are different IPC sections of which a mentally harassing person can be tried and brought to justice. Now, this is very important, physical harassment. This is a prevention of violation against doctors, medical professional and medical institution bill, which was done in 2019 after the NRS case specifically. And this has been amended in 2022 with the new name, Prevention of Violence Against Healthcare Professional and Clinical Establishment. Always, when there is a physical violence, always try to put in under this act, because the importance of this act is all harassment under this act is cognizable, non-bailable, triable by a judicial magistrate of first class. So you can have the lower courts can be bypassed. And it should be investigated not by the local OC, but by not below the rank of a deputy superintendent of police. Now, physical harassment in this law, there are certain terminologies which we need to know. Healthcare professional, anyone, even the ASHA worker, even the social worker associated with your hospital, even the I-bank personnel comes under the healthcare professional. Property, any property, movable, immovable asset of the doctor himself. It can be his own personal asset, or it can be a property of the hospital. Even medicines that are stored in the pharmacy of your hospital comes under the definition of property. Clinical establishment, the term clinical establishment in this act defines anything, any clinical establishment, even a pharmacy store, even anywhere where you are providing any kind of medical service to the patient. And violence, this term violence does not necessarily mean someone who is coming and beating you, but someone who is abetting to the violence, someone who is obstructing a medical professional from disbursing his duty. I will sit in front of your chamber and not let you see any more patients if you are not giving in to my demand. That is also violence under this act. So previous act had got a very diffuse kind of penalty, but now the penalty is very, very specific if it is a non-grievous hurt, if it is a grievous hurt, or if it is a grievous hurt, don't think that the compensation will be at 10 lakhs only or 10 years of imprisonment only. There is an additional clause provision that as per degree of harm inflicted, it may be decided by the competent court. Property damage, an amount equivalent to twice the amount of fair market value of the damaged property has to be given. So these things need to be there in your hospital displayed. And non-payment clause, if the person is unable to pay it, it will be as an area of Land Revenue Act, the next to kin has to keep paying that with interest. So physical, but don't think that at least in India, all laws will be in favor of the doctors. In the law itself, it has been said that there is a responsibility that these things need to be taken care of. Do not wait for long. All documents should be given to the patient, not that your next appointment is on such and such with such and such doctor, so that the patient can have a second opinion. No information asymmetry to the patient. One patient you are telling a little more about the surgical procedure, the other patient not, that is not. Have an appropriate grievance redressal system. There should be a grievance cell in the hospital where the patient can go and vent out. Have a liaison with the police. Transparency on the rates of, now this is a dicey situation. These are the loopholes where the patient party can, make a claim that the rates were not transparent. What kind of transparent rates or standard rate is there for a phaco surgery? We are yet to decide on that. Sensitize the public that the people, healthcare personnel are under constraints, and change the curriculum of the medical education. It has changed. Now ATCOM, that is attitude, communication and ethics, is a very much important integrated part of undergraduate medical training. So they are telling that to keep an explanatory note. This is nothing but a consent form in detail. These things should be there in, and most important is that when the patient is signing the consent, or the consent is being explained to the patient, that should be under a CCTV coverage with at least 2 minimum attesters, or who will sign the consent along with and is as a proof that this thing has been done. But this can be avoided in case of, if it's an emergency, you can avoid this. What is social media harassment? This is a very important thing. Half the time we are not aware that we are being harassed, or we are unnecessarily bothered with a social media thing of which we should not bother at all. So these are the few forms. I will give examples of each. Cyber stalking. What is cyber stalking? It is mostly done in case of female doctors. You find the patient or the concerned person is seeing your WhatsApp update for a number of times. He has been visiting your social media profile for a number of times and making comments which are not lewd, but everywhere you find that person present. What is catfishing? This is very important. Catfishing is that I have a profile, and with my kind of obesity, I'm not finding a suitor. I have placed the picture of Salman Khan in front of my social media picture, and I'm identifying myself with that picture. I'm not telling myself that I'm Salman Khan, but I'm a new person with someone else's picture or someone else's property. That is catfishing. Online impersonation is very common. Even 2-3 days back, we had a case where the phone was lost, and a WhatsApp call was given to 2 people to transfer money, and telling that I am in distress, please transfer with a message. So online, half the time the doctors are getting their Facebook profile hacked. So this is online impersonification. Doxing. Doxing, I'll give an example. Doxing is, suppose there is a center and a doctor. He's using a software for his prescriptions and all his appointments and all that. The software company comes and tells him that, sir, are you happy with this? So please give us a comment that you are happy. Now the doctor has given the this thing. Now this company, social software company, is publishing it in the social media platform and elsewhere, that see, this is our software, this software is being used by this doctor, he has got 5,000 patients have gone through this software, these are some of the star patients who are happy with the doctor with the help of our software. This, if done without your consent, then that is doxing, and it is a cyber harassment. What is trolling? Trolling is an example that a person is purposefully making absurd, lewd remarks on your social media platform. There is a case that a child of a established ophthalmologist had posted a picture, had drawn a picture of Shiva, but he's a 5-year-old child, and he has posted it in the social media, and they are continuously putting adverse remark. One person continuously putting adverse remark with that picture. So that is called trolling. All these are protected against the Information Technology Act. You need to lodge an FIR with always try to take the screenshot, or because the person might delete it afterwards. So Consumer Protection Act can give us. So how to handle? I will be very brief. Primordial prevention is very important. Prevent the risk factors. Feedback forms should be given to all patients. We have to see that there is no communication gap, and this is very important. A weekly autopsy. Suppose a turbulent incident has happened. So a weekly autopsy, discuss with your staff that why this turbulent event happened, or where can we do it. Make a grievance cell, and the grievance cell should be visible so that the person can go and vent out. Now, the primary prevention is that we have already discussed all these things. For the sake of time, I will not discuss. But it is better to nip it in the bud than to go into the tertiary and secondary prevention, which Bhaskar sir will say. We all know what happens when a doctor goes to court. So let not the doctor be dragged to the court. So I will end with this, that first thing we have to tell ourselves, we are not at war with our patients. Every patient is not potentially harassing. Services provided must be worthy of the cost incurred. If you are overcharging your patient, or if you are maliciously trying to do all those things, then that will have an adverse effect. And let's be ready to face constructive criticism also. Thank you.
Thank you, Dr. Purban.